Hello everyone, welcome to our webinar. I'm Jenny from Education team at Medit. Nice to meet you everyone. And as you can see, it's our first year of doing this kind of webinar with 3 participants. So please say hello to everyone. Hello.
Hello everyone.
Okay, maybe a time is 3 times more interesting and valuable time for everyone. So starting with Dr. Shakar. Hello doctor, आप कैसे हो?
मैं बहुत अच्छा हूँ, थैंक यू। आप कैसे हो?
Oh, मैं ठीक हूँ. I'm fine.
परफेक्ट।
Okay, hello Sakarika.
Hello, hi, how are you, Jenny?
I'm good, thank you. So, doctor, how do you feel today?
Well, I feel privileged to be a part of Medit and Medit webinar with you all. And what can I say more? Lucky to be a part of Medit
We are so very
since day one of my practice.
mm, okay. Okay, thank you for joining us, doctor. So next to Dr. Sakar is Sagarika. So she's a big help from education team in India. So can you introduce a little bit about yourself?
Yes, sure. Okay, so my name is Dr. Sagarika. I'm here a product specialist for Medit for the country, and I'm here to support for trainings, for any troubleshoots, and basically all the events and everything happening in the country for Medit. And I've been here since 2023 now, so here to stay.
Yeah, thank you for joining us today. Most of you don't know about Dr. Shagar. So Shagarika will introduce about him briefly. So can you introduce about him?
Absolutely, it's my absolute pleasure. So Dr. Sagar, he's absolutely he's a budding dentist. Now, obviously, he's been practicing for a long time, but we may not have seen him on our Medit platform yet. So please let me introduce to him. So he's Dr. Sagar Narayankar, and I've been following his journey since the past 2-3 years now. He has a diverse, varied experience. Let me just introduce him briefly. So he's done his Doctors of Dental Sciences in 2017 and his master's MD Prosthodontics in 2022 from Bharati Vidyapeeth, Pune. He is also the head prosthodontist in Mukta Dental Clinic and Implant Center. And he also is an actively participating and part of Lifeline Hospital at Boisar. So Dr. Sagar provides comprehensive treatment plans for implants, crowns, bridges, dentures, full mouth rehabilitation. He has a unique practice of basically, along with his dentistry, along with his clinic, he also does consultations. So he's passionate about improving patient outcomes by utilizing the latest technologies and digital prosthodontics. And we are so grateful that he is chosen Medit as his digital partner for this, right? So professionally, he has been a part of Prosthodontic Society since 2019. He has also done papers on CBCT, white papers on CBCT, and it has been published in Lambert Academic as well. Yeah, okay. We can find a small image on the right hand side, right here. If you can see on that side is yeah, right there. That's Dr. Sagar's book as well. So, sir, if you could just tell us a little bit about your book, that would be like really, really insightful.
Yeah, thank you for the introduction, Sagarika. Thank you. So what can I say about my book? Basically, I wrote this book with a very brief knowledge on how the CBCT, the modality, changed the implantology in past 10 to 15 years in India, especially. So I was very keen to learn and also to know my fellows to how can we integrate CBCT, including our digital dentistry, and combine two of the platforms to just enhance your dental practice. And that's all.
Awesome, awesome. That's great. Thank you so much for that. Over to you, Jenny. You could, yeah.
Hey, thank you for introducing about Dr. Shakar. So it's such a
Thank you.
pleasure to have such a busy and active doctor to our Medit webinar.
The pleasure is mine as well, Jen.
Okay, so before we begin, let's talk about today's topic. We are back to the topic. So can you tell us a little bit about your topic? Integrate, innovative, thrive digital dentistry.
Sure. So basically, I'll be speaking on integrate, innovate, and thrive digital dentistry. So it's a very basic thing to understand that integration of digital dentistry, that is your intraoral scanners and CAD/CAM technology into your dental practice. It has become a very basic need to of an dentist. So why? So the question comes why? To integrate it, now we all know the time frame a dentist takes to from start of the treatment to end of the treatment. The time frame is very important these days. But, as we all know, time is money for
Yeah.
everyone. Yeah. So integrating digital technology and saving your time is also saving your money and giving a upper hand to a dentist practicing in the very great pool of dentists around you, and integrating the digital technology, that is intraoral scanners, and learning it on a daily basis, and innovations with the digital scanners will give you a great scope of improvement and to save your time, and just a greater experience to your patients, so patients can understand the treatment plans, and you can make them feel what is coming to you as a part of treatment. That's all. And thriving on it is basically what? So on a daily basis, using your oral scanners, intraoral scanners, and your CAD/CAM technology into your clinics is very important these days. So that's all. And one more important thing I would like to say, in developing countries, I feel integrating this specific intraoral scanners is very important, because budding dentists mainly require this tool as a this tool to enhance their practice and give a better treatment to their patients as well. So they should know why it is very much important to get this tool for
Yeah.
your treatment. Yeah.
So do you have intraoral scanner, 3D
Yeah.
printer, CVT,
I
everything?
I I I have basic base. I'm just into practice. I've started with my practice, prosthodontic practice, 3 years back. So for me, buying intraoral scanner was very important.
Mhm.
Recently, I'm working on buying a CAD/CAM mill machines for my clinic as well.
Oh.
So for the same reason, to save the time of the patients, and patient convenience is my top priority in my dental practice.
Nice. I hope
Yeah.
many users change their minds to step of digital treatment, right?
Yes. Yes, Jenny.
Okay, so let's get it started, doctor.
Yeah. So, hello everyone. So, today we'll be talking on a sweet and short topic, that how to integrate, innovate, and thrive in digital dentistry. For those who don't know, I am Dr. Sagar Narayankar. I'm a prosthodontist and oral implantologist by profession, and I am a full-time practitioner at my own private clinic. I am practicing since 5 years with my elder brother, Dr. Suraj Narayankar, at our private clinic since 8 years, and he is a senior periodontist and implantologist by profession as well. And I am heading his prosthetic department since 4 years and helping him out throughout the cases for the prosthetic outcomes. And collectively, we do it better, we think. So let's start with answering your questions, that who all should integrate, how to integrate, and why to integrate digital technology into practice. So who all should be integrating the digital technology in their practices? Basically, I feel the young dentists are on top priority, as they are the building blocks of our future dentistry. They should be integrating the digital dentistry in their practice, like intraoral scanners, CAD/CAM milling techniques, and advanced digital dental labs for the reason which is necessary for the future practice of dentists and for better outcomes for quick results, I feel. Next comes in our list is the aesthetic dentists, particularly who works in the aesthetic region and aesthetic zones, working with their laminates and veneers specifically, uh, and including implants. Why I feel the aesthetic dentist should also integrate the intraoral scanners is the particularly they can show the outcomes of their treatment and the future of the treatment they are giving to their patients, uh, which in short can give the basic idea or treatment ideas for their patients who are going to get the treatment done. Next are the prosthodontists in the list. Basically, prosthodontists as a dentist are very much important and crucial for the building of digital dentistry, I feel, as they also work on a very intensive rehabilitative programs or cases which are necessary and which require a lot of time, I feel. And to reduce the work time, I feel the prosthodontist also should integrate the digital technology into their practice. And we all know implantologist and implantology as a field is growing day by day, which is a very important part in the dentistry as a rehabilitative uh, part of dentistry. It's a vast uh, field in itself, and how to reduce the complications in implantology and how to make implantology simpler for uh, new implantologists and the dentists who are planning to jump into the implantology practice. Now, the dentists who practice in the three-tier cities and small towns, specifically the dentists like me, during my initial practice, I faced a problem of getting in touch with my lab persons as they uh, have their labs in the center of Mumbai. So communication with them was a task initially before getting into digital dentistry and before buying an intraoral scanner. So I feel the dentists who practice in the small towns and three-tier cities are are to have a intraoral scanner for be a very basic step towards the digital dentistry, and dentists who have a minimum dental lab support. So basically the distance what we need to cover to for the communication with our dental labs, that is sending our work or receiving the work from the dental labs, is a tedious task for a clinician as for the dental lab technicians as well. So to minimize this, the dentists who have a minimum dental lab support should also think of getting into digital dentistry. Next are the dentists who prefer to work with multiple labs. So many of the dentists I have worked or I have been with or who are in touch with the different or multiple labs. The specific reason I have found out they are into different in touch with the different labs, as some of the labs gain their specialities working into different kind of forte. Like few labs are good in their fixed prosthetics, and few of the labs work well with um, the implantology work and the implant supported prosthesis, and few labs are good with their removable dentures and denture works. So I feel the dentist who prefer to work with multiple labs should also get into uh, the get into working with the intraoral scanners, and they might uh, reduce their tedious task of managing their multiple labs. So next is how to integrate digital dentistry. First of all, I feel that you should have a basic idea of your practice needs. That is, evaluating your practice needs is a very important part in integrating the digital dentistry or with the intraoral scanners, I feel. You should know your that is the digital dentistry is really gonna help you with your dental practice. And next question for falls is how, and investing in the what kind of equipments is going to help you in the digital dentistry. So investing in right equipment is a very important part, I feel, because the equipment which we are going to invest will be of what I feel is what I feel is many a times we buy the equipments required in our clinics impulsively. So I feel investing in the right equipment and comparing many equipments or the digital equipments which are we are planning to buy, comparison is very necessary for those equipments. And once you buy or invest in your right equipment, the right kind of training and education is very much necessary, as without the training part and education part of the particular equipment, you cannot utilize it completely in your dental practice. And once you train and educate in the using of your equipment, the basic idea of incorporating it in your regular workflow is very much necessary. I feel, because if even after training and education in your digital dental practice, many of the people for many reasons stop using their scanners, or they just monotonously use it for their just fixed prosthetics or crown and bridge purposes. And so in you should incorporate the digital scanners in every aspect possible in your practice. Next comes is our treatment planning and communication. So expanding your expertise in treatment planning and communication using your scanners and your softwares on your particularly on softwares which you're working. And I feel it's very much necessary, because without uh, planning your treatment or communication digitally, it won't uh, elevate your horizon for practicing digitally. And optimization for your financial success. You should always, after investment, you should always optimize your digital practice and in balancing with your financial success as well. And at last step, you should always consider expanding to 3D printing and milling. That is, your chair side lab should always be a next step to your intraoral scanners and digital dentistry. Now, why it is important to integrate digital dentistry in your day-to-day practice? Uh, there are a number of reasons that it has many dentists are going towards the digital dentistry. And few reasons I have mentioned is there's improved accuracy and precision. Uh, Scanning has enhanced uh, and multiplied the accuracy and precision of your dental practice, and enhanced patient comfort. Now, the patient comfort is our topmost priority as a dentist. Without without comforting patient, executing your treatment is very much tricky part. And next is our cost saving. Cost saving, I feel it's very subjective, but still I have mentioned this for a point for some particular reason. As once you get into digital dentistry, I feel the material cost which we are having in our day-to-day dental practice reduces. And that adds up to your investments in and diversifying your savings into some uh, better equipments and better materials. And after getting into digital practice, streamlining your workflow, that is balancing or in streamlining your work with your labs, with your technicians, with your colleagues, or with your interdisciplinary approach is very much important. And next comes is our predictability and quality control. And also technological advancements and competitiveness is a very important factor. As we all know, day by day the technology is getting advanced, and keeping up with the pace of digital advancements is very much necessary. And it in the field of competitiveness, I feel incorporating digital technology into dental practice boosts your competitiveness, or give you a greater or a larger head start in your practice. And yes, also to our mother nature, we should be thinking of an eco-friendly dental practice. Eco-friendly means in a way that the material or the what we dental materials we use can or maybe cause some environmental or environment hazards. So yes, it also adds up to your eco-friendly practice. Next is innovating with your intraoral scanners. Now, this is my heart of my practice since 2 years. That is an Medit I600 intraoral scanner, which is with me since 2 years, and it is working beautifully since then. And I have hardly faced any issues using this beautiful piece of technology. And I personally thank Medit to uh, developing in such a beautiful technology, and specifically uh, the software which I have been using with the Medit. So unleashing how to unleash your scanner's potential. It has been what I have observed using my scanners and talking with my colleagues or with my fellow dentists is many of the dentists just get hanged with the impressions kind, the crown and bridge impressions. I feel the scanners are not built for only the crown and bridge impressions, or the it is something, it is built for something beyond the crown and bridge impressions. And the horizon is much more wider than we think in digital practice. Now, integrating your intraoral scanners with the CAD/CAM systems nowadays, the CAD/CAM systems are advanced beyond our imagination, and the precision with what they work for execution of our processes with the precision with what they work is beautiful. And I feel the integrating with the CAD/CAM systems available in the market, researching them and working with in integration with the CAD/CAM systems have boosted the dentistry in a different level. And next is boosting our patient experience and case acceptance. So basically, after getting into digital practice, what I have felt that acceptance of the treatment have increased by, and the acceptance of the treatment by the patients have increased in a different way, or you can say has maximized. And the practice since integrating the scanner into my practice is very much boosted the patient's confidence my uh, in my practice, in my day-to-day practice, I feel. And also using the scanners, using the intraoral scanners for the long-term monitoring. The scanners are not only for the start of your treatment, but also to keep a close eye on your patients, that how effectively they are doing their work, the processes, how for a long time it's working, and the treatment you have given to your patients, is it holding up, or is it surviving or not. Mm, the scanners can also give a judgment for your monitoring. Enabling multi-specialty collaboration. So many dentists or specialists work, or they like to work in a multidisciplinary approach that is very much necessary for today's dental practice, I feel. And you cannot be a sole dentist giving the precise treatment to your patient. You should be having a multidisciplinary approach. And I feel discussing your cases on a digital platform is has become quite easier, what I feel. As after as a pers as a personal on a personal level, I also discuss my cases, my prosthetic cases with my orthodontist or my periodontist for better aesthetic outcomes. And yes, it has enhanced and given a better results in my few of the cases. And as we all know, the artificial intelligence is growing day by day. Integrating your digital dental practice with AI-powered softwares will be a future of our digital dentistry. So, as I said, not restricting yourself, scanning your patients for only crown and bridges. So here are a few of the cases I'll be sharing, or few of the captures I'll be showing you for few particular reasons, that how you can unleash your scanner's potential. Now, scanning for inlay on onlay or overlays, whatever the cases or different type of cases you're doing in your day-to-day practice, except your crown and bridges, the bondable restorations are very much important as a conservative approach for your treatment. And as you can see, the scanner, the preparations, the execution and visualization of your prosthesis digitally, and just giving them after all the verifications needed digitally, and delivering it to your patient has become easy, and the scope or margin of error has been reduced immensely. Now, particularly, I'll be showing this case which I have scanned for the endocrown. As you observe, the scanner do not miss any part or depth of your endocrowns or inlays or onlays. It beautifully scans or uh, it beautifully records the depth of the preparations you have made, except for your crown and bridge or your regular crowns. And that's what I try to tell my fellow dentists, that you should never restrict yourself with only the crown and bridge scans. So you can see the cast, how beautifully the impression is recorded digitally and printed in 3D printed in the resin, and execution of the prosthesis fabrication and recording it after bonding it to the patients. I always prefer to record my post treatment. Now, next part is I specifically sometimes I scan my patients for pre-surgical soft tissue profiles. This function, this feature is very much important for your giving the best results in the aesthetic zones, including for particularly for your implants or implant aesthetics. And the soft tissue profile you tend to or plan to build after the processes is in fabrication, and you can see how pre-surgical scanning has been done and the soft tissue is recorded, and you can see how beautifully the prosthesis is fabricated using your pre-surgical soft tissue profiling or pre-surgical soft tissue recording digitally. And the soft tissue profile stays with you in the form of data, so uh, no need to worry that the cast or the record is going to get misplaced somewhere, or you need to make multiple impressions after that. Now, I love the feature of reverse impression and impression scan. As we all know, the removable once we start working with our removable dentures or full dentures, partial dentures, keeping the casts or keeping the records for your removable dentures is very difficult part, or a very tricky thing to have. So I feel the keeping your manual impressions and converting it into a digital record is a boost, and the references for the the treatment references you might need in the future for your removable cases. And this particular function is helping me a lot with my manual impressions, and convert it into a digital impressions, and sharing or working with the lab has uh, is the my task. Next, we'll move on to the feature of scanning for your removable partial dentures. As we can see how beautifully the intraoral scanners record your soft tissue, your hard tissue, and the depth of the scan is particularly well defined for the recording or extensions and planning for your cast partials or whatever treatment you are choosing for your patient. And planning it digitally has become a very advantage in the treatment planning. Now, scanning for your removable partial dentures or the interim dentures or interim prosthesis is has become very easy using the intraoral scanners. As we can see, the recording capacity of the intraoral scanners for your soft tissue has is as good as recording it manually, and the extensions to which you are tend to record your impressions manually, and also uh, giving it the advantage of recording your uh, bite records. They also can be recorded digitally, and the execution of your treatment plan for your patient can be discussed in a very easier or quick manner with your dental technicians or the labs which you prefer to work with. Now, here specifically, I would like to discuss my early, uh, during my early practice of as a prosthodontist, my patient of full mouth rehabilitation. Now, if you specifically look into this case, I have reverse scanned the impression, and also the bite records were recorded digitally using a Lucia jig, and I particularly chose to record the impression because uh, the requirement of the margins to depth of the margin and recording of the margins, I prefer to record digitally, where I felt it would be good in my impressions by um, mm, recording them uh, into impressions would be of advantage using my cord packing techniques and retractions of my soft tissue, and it came out beautifully. The results which I was expecting during my reverse impressions, where I achieved them using the reverse impression technique. And if you see, converting into a digital record and recording my bite records digitally, the occlusion analyzer specifically restricted to Medit link or the software by Medit allowed me to evaluate my preparations or occlusal reduction, which was needed posteriorly, and it showed me the deficit reduction, and advised me to exactly how much it was required for how much it was required in the posterior region to give a good final prosthetic outcome. So if you see, after making the impression, it was not uh, that I had to make a double impression or record or do the cord packing and just following the conventional impression and doing every from start to end, everything like start to end. So what this feature allowed me to do is modify my impressions intraorally and integrating them digitally with my reverse impressions, and it is a superb feature, and you can look into the uh, scan how beautifully it has merged the two things. It can only be achieved with a achieved by on a digital platform or digitally, and I feel this particular thing can save immense time and energy you put into your cases, and with the same results you expect doing it in a tedious manner. Now it is a same full mouth rehabilitation case which I recorded after the delivering my crowns and cementation, and this patient came to me after 4 years of uh, holding up, and a few of his crowns were chipped off. So it was not a tedious part to the replacement of his chipped off crowns, as I had previous digital records for this particular case, and it was just an hour work to remove the old crowns, refine my margins, and record it with uh, my digital scanner, and merging it with my old scans, and the execution of and mergence of the two things was beautifully done by the software itself, and I had no problem giving the patient the crowns within a day or two. Now you can just have a gist of how I make the impressions of my edentulous arches for my full mouth rehabilitation cases, and using the scan bodies, using my scanner, and the soft tissue profile which I need to register for my implant cases. Everything is recorded with my scanner in a very smooth manner, and the case the case is my every implant case I record, and none of the cases till now has been given me a hard time, and the prostheses have come out beautifully, and maximum for my single implant cases, I take a day or two for my fabrication of my prosthesis. So the time frame which in I work with my intraoral scanner uh, has been cut down to by 2 to 3 days, and that is a lot of time for my patient and for me as well as a clinician. Now, I would like to specifically specify the Medit Ortho Simulation app, which comes with the software, and before even the consultation or having a discussion with my orthodontist, I at least take care that how the orthodontic treatment in a way is going to change my patient's bite, smile, and how his teeth are going to align after getting the orthodontic treatment done. It gives my patient a very basic idea that how the tooth movement is going to be, and how the final execution is going to be, and how the patient's teeth are going to look after the treatment that takes an year or more in sometimes in the ortho treatment, as we all know. Um, so giving gist of giving or dipping your patient into his future smile boosts his confidence into the acceptance of the treatment, and also adding up into your finances or financial success, I feel. And the best occlusion analyzer app I have come across in integrated with your intraoral scanner is Medit Occlusion Analyzer. I am totally in depth of the discrepancies I am avoiding since using my intraoral scanners of my basic single crowns or multiple crowns or full mouth cases, as Merit Occlusion Analyzer specifically shows me the amount of tooth reduction or occlusal reduction I needed for my selection according to selection of my prosthesis in the terms of micros or in figures of that is specifically required to for a better outcome of my prosthesis. And it also the medit margin lines also gives me a upper hand to guide my technician or my digital technician to till what extent my margins should be in my final prosthesis. And I have a freedom of selecting my margins and guiding him to fabricate a fine and refined prosthesis. And it becomes easy. It becomes easy for my technician to not to tackle with or just putting some random depth of my margins. And it is always in complex cases is determined by myself and extensions of the margins. And he creates or he digitally cross checks it with his own work, and the prosthesis comes out to be a perfect fit for my patients. And hardly it gives me any scope of refinement or some changes chair side I require for my patients before I used to do it without the intraoral scanners. Now, as we all know, aesthetic is a very important part delivering in prosthesis of a patient. And you don't have to always need to have your the DSLRs or better image capturing phones. The my intraoral scanner does it for me. It captures then HD images for enhancing my aesthetics for my crown and bridges, for my anterior cases, and for my implants as well. It records the fine details over which are required uh, to match it in the maximum way possible for my technician with the rest of the teeth or specifically in the aesthetic zone. And the shade matching or the mm, like stains over the teeth, fracture lines, to replicate them on the natural or the replicate them on the prosthesis is very difficult. And the execution of such prosthesis it can be achieved by good photographs, and my scanner does it for me as well. Now, the important aspect of delivering your is the veneers or crowns in your aesthetic regions, or uh, the ratio of your pink and white aesthetics. Medit scanners also does it for me, not leaving the very important part, that is the digital shade guide for clinicians' convenience. You can look how we can digitally record the shade or of the different region of a particular tooth. That is, the first image shows us the shade before the before the preparation or the pre-prosthetic, or and after the preparation how the shade changes, and also recording your shade of adjacent teeth, and collaborating all this data to for the execution of a beautiful final prosthesis with least amount of corrections in the final prosthesis, and saving your time. These are few Medit apps which I use on a regular basis. That is my comparison of pre and post treatment. Ortho simulation calibration wizard is a application for your calibration device, and crown fit, smile design, model builder. I'm still about to learn a lot about the smile designing application, but mostly I use the crown fit and the occlusion analyzer applications built by Medit, and the HD camera thing always helps me to record my to capture the images of my aesthetic preparations, and also my posterior ones. And the prep analyzer gives me a gist that is there any undercut in my preparation, or is there any undercut in my preparations which I do for my removable or removable partial dentures. And the prep analyzer also evaluates and give me an idea about how precise I am working or doing my preparations, and uh, keeping in check with my preparation, and not aggressively compromising the tooth material. So we come to the last part of our sweet and short lecture, that is thriving on digital dentistry. Uh, Thriving on digital dentistry is very subjective, and it depends on how a particular clinician or how a particular specialist look towards your digital practice. But what I feel that mastering your technology is very important aspect of thriving on your digital workflow, or digital dentistry you need to practice in your day-to-day life. And thriving on the digital dentistry or digital practice is redesigning your clinical workflows. You don't have to stick after getting into digital dentistry. It is not necessary to stick with your conventional work methods or conventional workflows. You need to redesign your clinical workflow, your collaborations with your labs, and your interactions or your training with your dental auxiliary staff, and your juniors or the associates which you work with. And you need to redesign and collaborate with the uh, team, or the dental team you work with. Now, collaboration with digital platform, that is collaborating with your fellow dentist to maximize your interdisciplinary approach to complex dental cases, which I feel is very much necessary, because what I feel, the outcomes of your treatment enhance immensely if you work on a interdisciplinary front. And it also gives the best to your patients, and uh, the patient mm, feel the difference in your treatment, and how differently you stand up in this field of dentistry. It is you doing all this thing, but you lack in marketing of your modern practice. And just if you fail to show people how differently you practice, or what's different in your practice, and why the patient should choose you and not others for the treatment they are the quality treatment they are searching in the market. So uh, presenting yourself and your work, your digital work, include with the use of dental marketing strategies, is very much important to enhance your dental practice. And it boosts your financial it boosts your financial stability in your dental practice. And it also help you to grow your dental practice in many ways. And I feel the digital dentistry is so vast that you have to keep learning about it and keep adapting to the changing nature of the digital dentistry. And it can happen by attending the as many as possible courses or courses about the digital dentistry, or keep learning or attend the conferences which are particularly based or based on the platform of digital technology or digital dentistry. And once you keep your touch with the such lectures or such conferences, uh, you grow you grow in a way that even you can't imagine. And you just keep adding more things in your digital dental practice, I feel. Now, this particular image I have put to make you an understanding that how the circle of digital dentistry works for me. That is, as a dental clinic, I record my dental record my uh, dental impressions digitally. How I link it with my lab using the MeditLink software, and how the dental lab just provides me the best prosthetic results. And this cycle has helped me to boost my practice and grow it in a way that even I haven't imagined 2 years before getting into digital dentistry. So collaborating as a dentist with the digital technology uh, is going to be a boost in your dental practice. And I always try to tell my fellow colleagues, and even as many as people I meet, I tell them how the digital dentistry and how my intraoral scanner has boosted my dental practice, and why they should greet hands with the digital technology to enhance their practice, and how it is helping me. And I make them understand the advantages, and why it is necessary in today's dental practice to have an intraoral scanner. I would like to finish with saying that never forget your roots, but also never forget that you can always grow new branches. So this statement tells you that the basics can never change, and the basics you have learned are the true pillars of your dentistry. You should never forget your roots, and you should never forget your basics, but also keep learning new things, and keep including or keep adding new or digital platforms to your dental practice. And once you step into digital dentistry, there's no stopping, and there's nothing can hold you back achieving the greater things in the field of competitiveness and the field of digital dentistry, I feel. Lastly, I would like to thank the Medit and my fellow clinicians, and father, especially who belongs to a field. As a radiologist, he has always uh, taught me the advantages of technology, how technology can be used for the benefit of mankind. And since then, um, I just try to integrate technology for betterment of the treatment I give to my patients. Thank you.
Okay, thank you for preparing such a great lecture. Let's move on to Q&A session. So today we
Thank you,
have
Jenny.
four questions and that are frequently asked by beginners. Question number one, how did digital dentistry has changed your clinic? What is the most big change?
So primarily the change is saving my patient's time is the biggest change I have noticed. And the precision with I'm working right now is immensely increased. As a clinician, to save my time and to do time number of patients I am doing in a day have improved. And the most biggest change I feel is I can educate my patients very well by scanning and knowing them that is what actually they need as a part of dental treatment. And I can just show them the futuristic thing, what they are going to get and what they are going to achieve by as a part of treatment. And the results, and also the Medit link softwares and the integrated thing have given me a upper hand on showing them what is going to be the final outcome of your treatment.
So we have Ortho Analyzer and Smile Design app. So these apps help to explain to the patient, right?
Perfect, perfect. And
Mm.
mainly as a prosthodontist, I work on the main part post prosthetic treatments is the occlusion of the patients.
Ah,
So I really thank Merit to integrate software that occlusal analyzer as a integrated part of the Merit system. That this thing has been helping me immensely during my treating my full mouth patients, and my implant occlusion, setting them right, and uh, giving a perfect occlusal schemes to my patients. I just thank to Medit team to integrating such a great software into their system.
okay, thank you for saying that. Okay, next question will be done by Sagarika.
Yeah, absolutely. So the next question is, do you still take rubber impressions sometimes? Because I think as a beginner, if there's a dentist who's like, how do we really directly switch over to digital completely? So do you sometimes also take digital rubber-based impressions or analog impressions?
As I've learned from my father and my guide, that never forget your basics. So yes, I do make rubber impressions sometimes that are very essential for the edentulous patients. But yes, Medit in a way has helped me to keep those rubber impressions into my records. By scanning the impressions, I keep them as a digital record as well. So now keeping my actual impressions into my digital record is being made very easy. So I do take rubber impressions for my edentulous patients, but yes, I do actually make them digital my part of my digital library as well.
So you take reverse impressions using the impression.
Yes, using Medit, I do make reverse impressions of my actual rubber impressions.
Awesome. That's great.
Okay, thank you for answering question number two. Question number three, what is the most powerful advantage of having intraoral scanner?
the the most powerful advantage of of having a oral scanner, intraoral scanner is, I guess, the sometimes as a prosthodontist or sometimes as a general dentist, we are bound to have a mistake in our impressions. So correcting them very quickly with the intraoral scanners is very easy, have become very easy. We don't have to repeat the impressions. So we can, and doing that, we save a lot of time, time of the patient and time of the lab. And at the same time, doing the patients, we can communicate with our dental labs, and we discuss the patient's chair side. So what kind of shade
Oh, yeah.
or what kind of preparations they need, what corrections do they need to give the best outcomes for the prosthesis. So that is a very biggest advantage I feel with the intraoral scanners we use on a day-to-day basis. And I would also like to add a thing that the shade matching technology, what you have given in I600, have helped me a lot during my evening patients. Would which I do. The shade guides which you have integrated in the Medit I600 helps me a
Yeah.
lot.
Mm.
That's a really powerful point, sir, because in the evening sometimes it does get a little bit difficult to get your shades right.
To
Yeah,
match the
So
shades as
makes the
yeah,
difference.
you're right. Yes, absolutely.
Mhm.
yeah.
Okay, last question. Sarika, can you read it?
Yeah, sure. So the last question here was, do you create simple prosthodontics in your clinic or do you order all of them through your lab?
Setting up a prosthetic lab with our clinic is quite difficult. But
Oh.
yes, the milling technology, the CAD/CAM mills, the zirconia mill crowns, and the peak prosthetic integration, the integration of peak. I
Mm.
specifically say about that. Milling is very convenient in chairside dentistry, which I'm planning to integrate soon with my practice. So right
Mhm.
now I am just dependent on my lab, but yes, soon I'll be integrating the CAD/CAM milling machines and uh, adding an advantage to my patient's prosthetic and the value to my dental practice. Hopefully I'll be practicing a dentistry where I can give the crowns or prostheses on the same day to my patients.
Mhm. So you don't do any single crown in your clinic yet?
uh, right now, no, Jenny. matlab, that's future plans.
Yes.
Not right now, but yes,
Mhm.
I have a two good lab support. So I do provide my patients the prosthesis
Mhm.
on the very next day after making the impressions.
Yeah.
That is all because of the intraoral scanner I'm having. Thanks to Medit, and what can I say? Thanks to Sagarika specifically, I'll say to, so she got me convinced to why should I buy the i600.
Mhm.
Long time ago.
Long time ago, but
Ah.
it was not only her convincing, but the she showed me the power of intraoral scanners using the Medit i600 and the value for money, I'll say, and that's all. I got convinced very quickly. But yes, I compared the other scanners as well with the Medit i600 and the features with which it comes, and the open source softwares you guys provide to us is very handy and very economical for us as compared to the other softwares available in the market. And the applications which you have integrated is thanks to Medit, I'll say.
Mm. Sharika did a very good job.
Yeah.
Oh, yeah.
I'm a very big fan of Medit.
I hope many dentists also got closer to Medit intraoral scanner.
Yes, yes.
Yeah. Okay, that's all about it for today. So it was a great pleasure to have Dr. Shakar and Shakarika. Thank you for being here.
The pleasure was mine as well. Thank you, Jenny. Thank you, Sagarika, for having me here. And it was a great experience, newer one as well.
Thank you. Thank you so much, Sagar, for being here. And Jenny, this was a fantastic introduction. Thank you so much for putting our Indian doctors on the stage as well. So much appreciate for that.
Yeah.
Okay, that was nice time. So, and see you next time. Bye bye.
Yes, Jenny. Bye. Thank you.
Bye bye.